Public perception is that radiation is generally a bad thing. But in medicine, it can be crucial both for diagnosis and for treatment. Everyone knows that if you break a bone, the doctors will check the break with X-rays, a type of radiation. X-rays were discovered by William Röntgen in 1895. Surprisingly, within only 2 months of their discovery, X-rays were already being used to treat cancer patients. Today, approximately 1/3 of UK residents will suffer from cancer at some point during their lives. And with current practice, about half of these will receive radiotherapy as part of their treatment. Predominantly, this radiotherapy is delivered in the form of X-rays and gamma rays. Since the first patient received radiotherapy, the techniques and equipment have improved almost beyond recognition. But one shouldn't be complacent, as side effects remain a major issue, and they limit the dose that can be given in various locations of the body. So if X-rays and gamma rays are so good, why do we need to explore other types of radiation? X-rays and gamma rays are a form of light, and in a very similar way to the torch beam, they diverge, making it difficult to hit the cancer without also affecting surrounding healthy tissue. They also pass through all the tissues within the beam path. What's more, the X-rays and gamma rays begin to deposit their energy as soon as they start to penetrate tissue, which means that healthy tissue between the radiation source and the target area may receive a bigger dose of radiation than the cancer itself. Radiation damages the DNA in cancer cells, and when these try to reproduce with the damaged DNA, they die or mutate. There is another method of radiotherapy that's gradually grown in importance since it was first attempted in the USA in 1954 on a young boy with an eye tumor. This treatment is particle therapy. This works in a slightly different way. Pencil-thin beams of accelerated charged particles can help to reduce overspill into healthy tissue. But more importantly, the particles deposit most of their energy at the so-called Bragg peak, beyond which there's very little or no energy deposition. The position of the Bragg peak is determined by the energy of the particles and therefore provides a mechanism by which the scientists can control the depth in the body for the majority of radiation deposition. Modern imaging techniques allow us to determine with high precision where the radiation should be deposited in and around a tumor. Before treatment, medical specialists will identify the precise location of the tumor. The energy of the particle beam, which is generally between about 100 to 400 MeV, is then selected to match the tumor depth. By modulating the particle energy, the radiation dose through the tumor can be maximized, while substantially reducing the risks to the surrounding healthy tissue in front of and behind the tumor. Also, the damage to the cancer cells per incident ion is significantly greater than that caused by X-rays, making it much less likely for the cancer cells to heal themselves. Damaging the DNA destroys specific cell functions, particularly the ability to divide and proliferate. Enzymes attempt to rebuild the injured areas of the DNA. However, if damage from the radiation is too extensive, the enzymes fail to adequately repair the injury. While both normal and cancerous cells go through this repair process, a cancer cell's ability to repair molecular injury is frequently inferior. As a result, and depending upon the type of cancer, the cancer cells often sustain more permanent damage and subsequent cell death than occurs in the normal cell population. This permits selective destruction of bad cells growing among good cells. The ultimate goal for Conforms Pamela is to enable protons to be replaced with carbon ions, which are 12 times heavier than protons and could cause more damage to the cancer cells. It's also considered that carbon ions require less local oxygen to facilitate the DNA damage, which could be useful as oxygen is in short supply within many tumours. Basrock hopes Pamela will point the way to significantly cheaper, more powerful facilities that can be introduced into many more hospitals and clinics across the UK and ultimately the world.